Right from start, the treatment has been evolving, and we are witnessing the 20th century, which is state of the art treatment modalities have come. Initially, the gold standard of treatment was doing a balloon dilatation, wherein a balloon is inserted through the scope at the junction of the food pipe and stomach lower esophageal sphincter. We inflate the balloon under endoscopic and fluoro guided, and we basically dilate that sphincter with the controlled radial expansion balloon, we call it as CRE, leading to relieving of the symptoms. But the problem with the balloon dilatation is that there is a risk of recurrence after 1 year in 60 to 70% of the cases. So the science has evolved, and then the second modality of treatment has come, which is laparoscopic Heller's myotomy, wherein by the laparoscopic surgery method we cut the muscle fiber up to 1 to 2 centimeter from the GE junction, that is thereby relaxing the sphincter and then helping in patients of Achalasia Cardia for the treatment. But what about those patients? We have type 1 and type 3 where there is a longitudinal muscle is completely involved. In that case, laparoscopic approach may not be that useful. In that case, the new modality of treatment has come, which is called as POEM, which is per oral endoscopic myotomy, wherein with the endoscope nowadays we can do a flexible endoscopic surgery. We can go into the esophagus, different layers in the wall of the esophagus. We call it a submucosal tunnel formation, and from the submucosa we go down and cut the longitudinal circular muscle and go down till the stomach, proximal stomach, and open this muscle wall. By cutting this muscle wall, we open the sphincter and thereby helping the patients in preventing the dysphagia. So basically, POEM has evolved and stood the test of time, and it is the first line of treatment for patients who have an Achalasia Cardia. The advantages of POEM are that we can treat all types of Achalasia Cardia, type 1, type 2, type 3. Although it is useful more for type 1 and 3, it also can be done as a short stay procedure. It has got other advantage that it has no scar, no incision made on the body. It is endoscopic surgery, and that's a state of art, and the results are very promising in patients who are getting treated with Achalasia Cardia. There are few general guidelines which we tell the patients who have an Achalasia Cardia is that they should not take hard foods like nuts, bread, doklas, and those substances which has hydrophilic properties which swell up and then can lead to more relapse of the symptoms. So whatever it is, basically Achalasia Cardia is motility disorder of the esophagus, which is usually diagnosed very late because of less awareness among clinicians and among patients, and usually the high-end investigations are not available at all centers like esophageal manometry and endoscopy. So before they can get diagnosed, it takes years together before they get treated by an expert.